Welcome to Healthy Heart, Healthy Life. My name is Melissa and I'm a wellness education specialist with CoxHealth Wellness. And this is a heart healthy course designed to help you learn more about taking care of yourself, living a healthy lifestyle, and working to avoid all types of heart disease. Your heart is an amazing organ, a strong muscle that pumps blood continuously during your entire life. Most people don't think much about their heart unless something goes wrong with it. We know that other people have heart disease. Often they are our close friends and relatives, but most of us believe that nothing will ever happen to us, that our own behaviors such as smoking, overeating, and lack of exercise won't have an effect on our heart or our health, and this is simply not true. Everybody can adopt lifestyle behaviors that will strengthen his or her cardiovascular system and lower health risks. Today we will be looking at many ideas, suggestions, and activities that can lead to better heart health. Your heart performs several actions that result in your continuing good health. Blood from your body enters the right atrium of your heart. The blood is transferred from the right ventricle and pumped to your lungs. In your lungs, the blood is cleaned and carbon dioxide and waste are removed from this used blood. Oxygen and nutrients are then added. The blood is returned to the left atrium of the heart and transferred to the left ventricle. Blood is pumped to all parts of the body where your tissue absorbs nutrients and oxygen. This process is repeated over and over. A strong, healthy heart performs these actions effectively and efficiently. A heart with problems such as cholesterol buildup in arteries or high blood pressure has to work much harder to keep going. While so many Americans are partaking in destructive behaviors such as smoking, excess drinking, lack of exercise, and drug misuse, they may not even realize that heart disease may be their actual cause of death. As tough as your heart is, just like with anything else, if we abuse it, it will break down. More than 900,000 Americans die each year from heart and blood vessel diseases. That comes to more than 2,500 people each day. The really sad part of all this is that many or most of these deaths could have been prevented. Now let's look at how to avoid heart disease and also improve health and increase longevity. First, let's look at the ways to reduce your risk of disease. By not smoking, moderate alcohol use, no misuse of drugs, regular activity, and good nutrition will cut premature deaths and chronic disability in the United States by half. So why doesn't everybody change his or her lifestyle behaviors and choices? Change is difficult, right? Maybe like so many other people, we like our lifestyle the way it is. And regardless of the damage it may be causing, we don't want to change. Have you ever heard somebody say, "I'll take better care of my heart after I have a heart attack"? Of course not. 1 in 3 people will die from their first heart attack, and the risk of death increases with each heart attack. Each of these 7 factors is well within our control. Not managing any one factor can increase your risk, and having several of these risk factors can put you at serious risk. So ask yourself, do I smoke or live with someone who does? Is my blood pressure above 140/90? Is my total cholesterol 200 or above? Do I consider myself overweight? Am I physically active fewer than 3 times a week? Do I get regular medical exams? Do I often eat food that is high in fat or saturated fat? Do I have a family history of chronic disease? And of course, this is our only risk factor that is not in our control. Each yes answer increases your risk. Several yes answers should sound the alarm that it is time to do something about your health. So cigarette smoking is the biggest single factor in sudden cardiac death. There is no longer any doubt that smoking is deadly to the person who smokes and anyone who is breathing secondhand smoke. If you worry about your smoking causing cancer, you should worry even more about your smoking causing heart disease. If you or anyone close to you smokes, quitting now is truly a matter of life and death. Knowing the danger is one thing, and actually quitting is another. While these days many adults are finding ways to quit smoking, at the same time about 4,000 American adolescents start smoking each day. And we know the earlier a smoker starts, the greater the health risks later on. Heart disease from smoking can sneak up on you over many years. And in many cases, by the time artery damage is diagnosed, it's usually too late to reverse the destruction. Cardiovascular damage can begin before birth and continue throughout childhood for children who have parents that have smoked. As blood pressure rises, your heart has to work harder to push blood through your body. High blood pressure can cause the heart to enlarge and weaken. According to the American Heart Association, 1 in 4 American adults has high blood pressure. If your blood pressure is at pre-hypertensive levels or higher, see your doctor right away. Get help in lowering your blood pressure. There are numerous ways to do this. If your blood pressure is normal, then keep up the good work. In order to keep your blood pressure in a healthy range, you will have to work at this for your entire life. Have your blood pressure checked periodically if you know you are at risk for coronary heart disease. Of course, blood pressure can be lowered and managed. There are a number of proven ways you can lower your blood pressure even without medication. Eating a diet moderate in animal fat, cholesterol, and sodium, and including fruits and vegetables in your diets each day. Daily physical activity will strengthen your cardiovascular system and lower blood pressure. Manage stress, relax, and get enough sleep. Take time to enjoy family and friends and resolve your problems as they arise. Women, if you take birth control pills, please check with your doctor about information on how this affects your birth control. Repressed anger increases blood pressure. Find ways to release anger safely through physical activity and problem solving. And discuss other medications you may be on with your doctor. These medications may have side effects on your blood pressure. If so, see if there are alternatives. Cholesterol levels, like blood pressure, can be controlled and managed with some planning and effort. More than half of all American adults are at risk with cholesterol level of 200 or higher. And this is an improvement over previous years. There's a tendency for cholesterol levels to increase as you get older. That doesn't mean it's healthy or necessary. But it tends to happen as one's lifestyle becomes less active and we become more sedentary. Increases in cholesterol also lead to coronary heart disease. Even though a cholesterol level of 200 is considered normal, people with a cholesterol level of 180 or less have only half the risk of those with a cholesterol level of 200 or more. In general, the lower the cholesterol, the lower your risk. You may be wondering, what are trans fatty acids exactly? In many foods, vegetable oils are infused with hydrogen to make them firm at room temperature. A good example is margarine. The harder the margarine, the more hydrogenated oil or trans fatty acid it has. The hydrogenated oil acts much the same as saturated fat in your body. It can result in increased blood cholesterol levels and increased risk for coronary heart disease. Watch for the phrase partially hydrogenated listed on your food labels. Keep your intake of hydrogenated fats or with trans fatty acids low. Learn to read your food labels. Antioxidants are also substances in foods that protect your body from serious diseases such as cancer, heart attack, and stroke. They do this by neutralizing dangerous cell byproducts called free radicals. Free radicals are created when the body metabolizes oxygen in your body. This is a normal and necessary process for maintaining life. If free radicals are not neutralized, they can damage cells and will cause disease. Antioxidants are found in fruits, vegetables, grains, and some animal products. Vitamin C, E, and beta-carotene are all antioxidants. Some foods are better sources of antioxidants than others. The vegetables listed here are all good sources, with the most abundant sources listed towards the top of the list. Eating a diet rich in whole foods and taking a multivitamin supplement will ensure adequate antioxidants in your diet. Carotenoids are found in more brightly colored fruits and vegetables, such as carrots, oranges, squash, and tomatoes. Carotenoids have been shown to be protective against heart attack as well. Eating fish just once a week has been shown to reduce the risk of heart attack and sudden death. Fatty acids such as omega-3s that are found in fish are shown to protect the heart from arrhythmia or irregular heartbeat, which is the major cause of cardiac arrest. And while it's true that nuts are slightly higher in fat and calories, research shows that the types of fats in nuts are actually protective to your heart. A handful of nuts each day won't add too many calories to your diet, but they will be heart healthy for you. Make sure you are using common sense in planning any weight loss program. You can usually continue to eat the things you like within moderation. Depending on your activity level, reducing your caloric intake by anywhere from between 250 to 500 calories a day should help you to lose about a half a pound or 1 pound each week, which is a healthy rate of weight loss. Much of the weight loss that can be lost through severe or rapid dieting will quickly be regained. A comprehensive long-term plan can help you lose weight and manage your weight over a lifetime. You need good nutrition when losing weight, and eating a variety of foods helps meet your nutritional needs. No single food or small food group can meet all your nutritional needs, even if you are taking a vitamin supplement. The American Heart Association estimates that 250,000 Americans die each year from a lack of physical activity. Believe it or not, a sedentary lifestyle is one of the major risk factors for coronary heart disease. Physical activity will increase your good cholesterol, burn fat, and is an important part of weight management. Exercise doesn't have to be difficult. Walking is the safest and easiest form of physical activity for most people. Physically fit men and women have a significantly lower risk of dying than those who are unfit and not physically active. In a comprehensive study, physical activity was also shown to partially counteract the destructive effects of smoking, high blood pressure, and high cholesterol, which are the 3 most common risk factors for heart disease and mortality. In other words, no matter which of the behaviors or health problems you have, physical activity can help. In this same study, those people who engaged in regular physical activity and smoked or had high blood pressure or high cholesterol lived longer than the sedentary people without any of those risk factors. Physical activity appears to be more important to health than most people think. Burning 3,000 calories a week through physical activity reduces overall death risk by more than half. And for most people, to burn 3,000 calories would only require about 1 hour a day of brisk walking each day. That is it. Healthy people should have a comprehensive physical checkup every 2 to 5 years. This should include a check of blood pressure, cholesterol, and weight. Early detection of symptoms makes prevention and treatment much easier. Your doctors will recommend how often you should have checkups depending on your age and your risk factor. Taking part in prevention in early treatment is more likely to be successful than beginning treatment only after you have suffered a heart attack or a stroke. You have control over the lifestyle that you live. Along with the other steps to a healthy heart, taking the time to make rational and logical lifestyle decisions can help you affect your day-to-day living and will certainly make a positive difference in your life. It's time to take charge, live longer, and feel better of your life. We've learned that emotions can definitely increase the risk of a heart attack. In numerous studies, anger and depression have been shown to increase the risk of heart attack. Anger increases blood pressure, constricts blood flow, and can increase the risk for blood clot. A depressed person is more likely to die following a heart attack than a person who has had a heart attack and is not depressed. Those with existing coronary heart disease were 3 times more likely to have a heart attack if they generally had negative emotions as opposed to a generally positive attitude. Learning how to manage or avoid potentially destructive behaviors and emotions can be important for many individuals. In summary, if we can learn to manage high blood pressure, keep our cholesterol in check, we don't smoke, we restrict animal fats and high sugars, as well as aim for 30 minutes to an hour of exercise a day, we can control our risk. Just about everyone could use a little help in planning lifestyle changes. We have talked about many possible changes today. Knowing something about how you change and what makes it difficult for you to change can help in your planning. Thank you for taking the time to listen today.